with you 3 stories, and then I'll ask you one question. First, the 3 stories. So these are stories from girls and women I met during my travels, largely in rural India, working on the subject of menstruation. So the picture that you see here is during a session we did at a government school in Assam. So there was one girl here, about 12 years of age. So she stood up and she asked us a question. She asked, when I got my first period, why was I not given anything to eat during the entire duration of my period? The second incident. These are pictures of my team working in villages across Karnataka. We went there to speak to women and understand their perspective of menstruation. As you can see, we spoke to them in their homes, sometimes in a cowshed, sometimes in the field when they took a break from work. So one of the questions we asked them was, according to you, why do women menstruate? Now, we were expecting the typical answer of because it's related to childbirth. But we were surprised that most women simply could not make that connect. For them, menstruation was a separate thing and childbirth was a separate event. So they said that we menstruate because if we did not, we would have a lot of health issues. Third story. Towards the last leg of our work in the villages in Karnataka, we suddenly met some 70 to 80 women. Overall, we spoke to about 1,000 women. And these women did not use any product during menstruation. No cloth, no pad, nothing. They just bled freely. In fact, when we asked them, what product do you use, they gave us this look as though there is something weird about the question itself. Before I tell you a little more about these stories, I have a question for you. So if I asked you to rate the menstrual health of India, especially of the women in rural India, would you say that it is good, average, or bad? It's an overwhelming bad, is it? Okay, thank you for the answer. So let's take a look at some numbers, some statistics from published research papers. So we studied about 100 plus papers to know what is the actual menstrual health parameters among women in India and among women in developed countries. Let's take a look. The first parameter we will look at is heavy menstrual bleeding, also called menorrhagia medically. So we looked at studies where Indian women self-reported that they experience heavy menstrual bleeding. And among such studies, the highest number we saw was 18.7%. Then we looked at studies where there were gynecologists involved. So gynecologists medically examined the women who were in the study. And among such studies, the highest prevalence we found was 15%. Now let's look at what these numbers are like in Europe. There was a 5-country study done in Europe. It was an internet-based study. And here, women self-reported the prevalence of heavy menstrual bleeding. And overall, it was 27%. India's was 18.7%. Just look at the countries and the numbers. Netherlands, 22%, and then the highest is Spain, 33%. There was another study done in England. This was a postal survey where they surveyed around 1,000 women in England. So when they did the baseline assessment and they looked at the responses, 52% women reported heavy menstrual bleeding. India's was 18.7%. Let's look at another parameter. This is the common menstrual pain and discomfort. It's called dysmenorrhea. This is high among teenagers everywhere, even in India. So if you look at the numbers, among rural girls, it was 62% in one study. And it was even more among urban girls. It was 72%. So what's it like in developed countries? Singapore, 83%. US, 85%. And in a study in Australia of around 1,000 teenagers, 94% girls reported that they experienced menstrual pain. And this, that is dysmenorrhea, is the #1 reason for girls being absent from school during menstruation. I'm sure that up until now, we've only heard that in India, girls miss school owing to menstruation. Look at these numbers. It's more in US, Australia, and other developed countries compared to India. And the reason is not sanitary napkins or toilets, it is dysmenorrhea. Now, some of you might actually be wondering, how come, in spite of the seemingly backward practices in India, Indian women actually seem to have better menstrual health? Well, it's not in spite of these practices, it's precisely because of it. Globally, the conversation on menstruation has largely been limited to menstrual hygiene and products. But in India, we always had a far deeper and a more comprehensive understanding of it. So let's revisit the stories that I first told you and see what's actually behind them. The young girl who asked us, why am I not given anything to eat? So when we probed further, we found out that she was actually given plenty of fruits to eat and water to drink. Now, it's a different story that according to her, eating fruits is not the same as eating food. Across India, in many states, we see that the first period, or menarche, is celebrated. This is done as part of a traditional culture. During these celebrations, restrictions in food is a very common thing, which in fact women carry on even later on in their life. Why? Why is there so much importance given to what we should eat or not eat during our period? We will find some explanations for this in Ayurveda. Now, Ayurveda uses the term ama to talk about toxins in our body that result from food being only partially digested or from waste that is not eliminated properly. And ama is the reason for most of the diseases in people. In women, one of the most common problems we see when they menstruate is menstrual cramps or pain or stomach upsets. And one of the reasons is excessive ama because of improper food habits just before or during their period. Unlike in men, women have a natural process every month by which this ama is forced out of the body. And that process is menstruation. So Ayurveda looks at menstruation as a sort of a detox process. And that's why a lot of women might actually realize that soon after their period, they feel so much better. Their skin actually glows. That's because you've just got a free detox. So now, picture that you are going through this process where all your waste elimination mechanisms are at its peak. For some women, they experience skin breakouts. Some women have excessive vomiting on the first day. And some women actually have loose bowel movements. So during this time, if you ate anything that's hard to digest, what would that do to your system? So that's why, culturally, so much importance is given to the right kind of diet during the period. And fruits is something that's very easy to digest, and that is why it is given as part of the culture itself to the girl when she first gets her period. Now, there is another very interesting aspect about celebrating menarche. It's there in our culture, especially in South India. So that's because the way you feel about your period will actually have a big impact on the way you feel during your period. Your attitude about the period makes a world of difference to how you experience it. There is a small part of our brain, it's called the hippocampus. Now, its job is to store and retrieve short-term and long-term memory with all the emotions and context of that incident when it happened first. So if you had a negative memory, every time you recollect it, your body goes into an involuntary response of whatever that memory was. If it was shock, you go into a shock response. So if the first period was one where you were anxious or angry or embarrassed or stressed out, it's very likely that during the subsequent periods, the memory you associate with it puts your body into a stress response. And once stress sets in, a lot of problems can happen. It disrupts your digestive system, further causing you menstrual pain. It can make your periods irregular. It can cause delay. So that's why in our culture, so much importance is given to how you should look at a period. You need to feel positive about it. So next time we crib and curse that we've started our bleeding, maybe we should think twice because it's going to come right back to us. The second story. I will admit that it took us a while to reconcile with the fact that so many women just don't make the connect between menstruation and childbirth. And we thought that's obvious. I think we spoke to at least 100 women before we paused to think that maybe it's our understanding that's actually incomplete. Our education system has reduced the purpose of menstruation to a once or twice in a lifetime event of childbirth. It's not uncommon today for young girls to say, if I don't intend to have a child, why should I menstruate? But that's not how the rural women look at it. For them, menstruation has more day-to-day benefits. They attach a lot of health benefits on a day-to-day basis to it. They feel, after observing their period for so long, they feel that any sickness or imbalance in a woman's body will actually show in the way she bleeds. In fact, even in Ayurveda, they say that the color, the texture, the odor, the quantity, all of this, if you look at it and you observe it, you will be able to tell if a woman is healthy or not. So in rural India, women look forward to their period because it's a natural indicator of whether or not they're healthy. And they take care of it accordingly. So the food restrictions, them taking rest during their period, these are all indicative of a deeper understanding of menstruation. One of the big lessons I learned while speaking to them was that when we meet women who are not from formal educational systems, we need to pay close attention to what they say. Because their knowledge comes from a much deeper understanding of their body, something that's been conditioned out of us by our education. So just when we thought that we've become very open to others' perspectives, we suddenly met women who don't use any product. And yes, we were also surprised. But then when we asked them other questions, we found that they did not have any symptom of menstrual disorder or any great indication of reproductive tract infection. So that's when we got curious and we started thinking, how come it is working for these women that they don't need to use any product and they don't have any major issue? So these women who you see, most of them are daily wage workers. They are not the ones who afford to take rest during menstruation because they would lose a day's wages. So even when they bleed, they have to work. And the kind of work they do, they spend 8 to 10 hours every day in the hot sun, physically toiling away. They sweat profusely during this time. Now imagine if such a woman, when she's out there working, had to use a sanitary napkin. Sanitary pads have a bottom layer made of plastic, which means that it's very unbreathable. You cannot have a circulation of air once you wear it. And in their circumstances, they don't have access to places to change the pads as often, which is at least every 4 to 6 hours. So if she had to wear a sanitary pad, or for that matter, even a cloth, she would have had to wear it for the entire 10 to 12 hours when she's out there working and could only change when she comes back home. What would that result in? Both the pad and the excess moisture would result in heat and wetness, which is perfect criteria for vaginal infections. Instead, what she does is pretty innovative. So the inner skirt of the sari, they use that to lift and tuck it in on both sides, forming a sort of a U. So that gives a much larger area into which they can bleed, all along making sure that they're also dry. Many times I wonder how we urban women make our choices. We say that we make informed decisions, which basically means that someone has to inform us for us to make our decision. We've lost the ability to listen to our own body communicate. In fact, even to know if what we are feeling is pain or pleasure, we have to rely on Google or advertisements. That's not the way it is for the rural woman. Her choices, whether to use a product or not and what product, it's based on how she feels and what her body needs in her circumstance. I've realized that without looking at the whole picture, if we just went in and did a half-baked approach of just giving sanitary napkins, it makes me wonder, would that really do them good or actually cause more harm if the rest of their environment and surroundings actually did not change? So these are just 3 stories to give you an idea, a glimpse into how women in rural India actually manage their period. They say social change takes a long time. I don't think that's because the problems are challenging. It's more because the problem solvers are. The conditioning in our mind is so severe that even if we have data and evidence and facts in front of us, it's so hard to believe that something we have thought for so long might in fact be wrong. And a clear example of that is this study. This is a study that was done comparing the menstrual health of adolescent girls in urban schools and rural schools in Nagpur. Look at the numbers. Dysmenorrhea, period pain. Rural girls had 41%, urban girls 72%. Premenstrual syndrome, rural girls 35%, urban girls 68%. It's pretty surprising, isn't it? But what does the study say? The study concludes by saying that so few rural girls actually use sanitary napkins and they have unsatisfactory cleaning of genitalia. We need to educate the rural girls. Even for curiosity's sake, don't we want to know how come? How come, in spite of our conceived notions of hygiene, the rural girls actually have better menstrual health? So the answer to the question I asked you in the beginning, the menstrual health of Indian women, especially rural Indian women, is good. Thank you.